All right, disorders of gender and sexuality. These are the ones that are more in the news these days than probably any other mental health concern. A few years back, there was a transgender female to male who was then pregnant. So it was on the talk shows, the man who was pregnant. A few years back, there was a pageant participant who was transgender. That was only like 2 or 3 or maybe 4 years ago, and already that seems very passé given our current cultural and societal discussion of transgender and just how common it is. And Caitlyn Jenner, for example, is kind of the face of that movement, just because that was a person who was already in the spotlight. There was already plenty of other people in before, but media tends to stick to people who are already famous. But we tend to be aware of these issues, or at least the gender part of this discussion, because media gets fixated on things that are not quote unquote the norm. And as this becomes more and more of a normalized discussion, it's possible this won't continue to be, news every time somebody does this. But that'll be a little while longer as our culture continues to adjust. But when we're talking about sex versus gender, I find that people mix them unnecessarily all the time. Applications mix them. Your sex is your biological status of being male or female. It is the anatomical parts that make you male or female. Your gender is what category you fit in based on your cultural or societal expectations that dictate what you should do, what you should believe, what kind of job should you have, so on and so forth. Gender roles or differences then are those imposed masculine or feminine roles or behaviors. These are much less, but we still do have them. Just for example, because I was at the hospital recently, they still refer to male nurses as male nurses. They feel the need to use the word male to qualify it, as if suggesting that nurse equals only woman. And that's just one really minor example, but it's a little bit of a sexist, gendered thinking that people don't really think about when they say that. Pink and blue for boys and girls is another one that's still with us to some degree, although I've seen more and more baby showers that are yellow and green. So things are changing. But in general, the identity as male or female becomes an important feature of the child's self-concept. And by toddler age, they're aware of their own sex, becoming more aware of the societal expectations of them equaling their gender, or what gender they're expected to be. Let's put it that way. So they start to organize the world. They use schemes, so some sort of structure to put things together. So a gender scheme or schema suggests that the cognitive developmental theory that views gender as a way that the child categorizes the world. So what toys do boys play with? What behaviors do girls show that boys don't? What attitudes are okay? Who should you use cute or handsome with? We don't really call little girls handsome. We just call little boys handsome. But we might call them both cute. They refer to all kinds of different things. So just keep in mind how much that still plays a role in your daily life. And then give some thought just on your own to, are we moving toward a genderless society? That's a whole other discussion that hasn't really begun in the public eye. There's several different movements. There's like the cisgender. There's groups that are going for absolute non-gender. There is no discussion of gender. There's the idea is that we shouldn't need to differentiate, period. So do we want to have a genderless society? Are there reasons to have genders? Are there needs? All thought questions for you. The diagnosis that goes along with the DSM-5 discussion is gender dysphoria. It used to be called gender identity disorder, but some key factors led to that change. The idea that your gender identity is a disorder was a concerning phrase, and so they changed the word to dysphoria, where you're not pleased or you're not happy with your current physical and cognitive awareness of you as a male or female. So it's your sense of being male or female that is not consistent with your actual anatomical sexual organs. So you have dysphoria over this disconnect. A person who feels that they are anatomically female but is actually a male. Some of these people go to greater lengths than others to make those two come together. Sex reassignment surgery, where you actually have some parts removed and other parts added, anatomical parts, would be potentially the furthest you could go. Hormone therapies are a step before that. Just choosing to dress and, stereotypically act male or female would be steps before that. So it'd be all kinds of discussions. And just other thought questions for you. I haven't heard the terms tomboy or sissy in a long time, but those are phrases that have been culturally with us. And society has thought about a female who acts a little more male differently from a male who acts a little more female in the gender discussion. And maybe because we are losing some of our rigid gender structures, tomboys and sissies are words that have kind of left us. But I don't think the idea has left us, especially depending on who you're talking to. So the question would be, why are they thought of as differently, or are they now? Have things changed? And then the acceptance of sex reassignment surgery, if you would even be aware of anyone, in your life who would have participated in that. Gender dysphoria theory, not fully clear why. Your book talks about several things. Is it because of parental expectations? Is there a genetic component? Are there hormone level differences in people? Is it related to body dysmorphic disorder? I'm sure it's some combination of all of that and a different combination for every single person, but something to think about. All right, so a different part of the discussion is on page 371. You have a chart of sexual dysfunctions. So that's the gender part and then the sexual part. And those two do not at all have to go together in the same person. They're just, for better or worse, lumped in the same category usually. So these can be lifetime issues that have always been present, or they can be acquired through through just aging or through some sort of damage. They can be situational, like with a certain person or a certain situation, or they can be generalized and they happen all the time everywhere. We won't necessarily go through all of them. I think you can read them and understand them for yourselves. And frankly, every other commercial is for an erectile dysfunction pill, so I think you're probably aware of some of these. But the three categories they break them in, and you can see that. Disorders involving a lack of sexual interest or lack of sexual excitement or arousal. So the difficulty specifically lies in that area. I worked with a man a few years back who had post-traumatic stress disorder, and so he could not essentially get in the mood for anything, let alone sex. So he would technically qualify for one of these, but it wasn't his major concern. It was connected to the major concern, but it certainly was a problem for his relationship. The next category, impaired orgasmic response. So there's something going on with the actual orgasm part. And then pain related to sexual activity. So disorders involving pain during intercourse or penetration. And there's really just one, and it's really just women, at least at this point. So you can kind of take a look through there and have a general sense of sexual dysfunctions. Paraphilias are another related category. And these are, so I'm writing here, have you run across any of these before? A lot of times people are fascinated by these. They're not as regularly seen as I think people think. But it's sexual arousal in response to something that would be considered abnormal. And, that phrase is being chipped away at, so I don't know how much longer our society will have things that are abnormal, but in general, these are things that aren't quite the mainline norm. Your book says that the word paraphilia was coined from the Greek roots para, meaning to the side of, and philos, meaning loving. So people with paraphilias have unusual or atypical patterns of sexual attraction that involve sexual arousal or loving in response to atypical stimuli. I kind of react to the word loving. I don't think that you have to have love to achieve sexual arousal. So I find that a misleading statement. So I would give that a thought. But they're either the paraphilia is the person either acts on the urge or is distressed by them. Some function in the absence. Some function well, as is quote-unquote normal members of society in absence of the stimuli that stimulate their paraphilic response. Others can't get aroused or respond without a certain stimulus, and then stress can play a factor. Just 2 examples, and there's maybe a couple others in your book you can look at. But transvestic fetishism, recurrent urges and fantasies to cross-dress for sexual arousal. So maybe you can have sexual arousal even when you don't cross-dress, but you want to. Or maybe you can't. So you need to cross-dress to be able to get sexual arousal. And this is mostly still seen in heterosexual men who are married. And then frauderism comes from the word fraudage, relates to sexual urges or fantasies when rubbing up against a non-consenting person, or a couch, something like that. But it's often thought of as a person. So like on the subway, if somebody's too close, maybe they're too close for a reason. Those are just examples of paraphilias.